The Department of Health and Human Services just announced dramatic and drastic cuts and changes to the agency run by RFK Jr. The agency is cutting 10,000 employees and combining 28 divisions into 15, as well as creating an administration for a healthy America. CNN's Meg Terrell joins us live. So Meg, as you know, HHS is a massive agency overseeing the CDC, the FDA, NIH, the Centers for Medicaid and Medicare, and that's just to name a few. So walk us through these significant changes.
Yeah, Manu, I mean, it's a large agency. It was 82,000 employees, and after this, it's going to be 62,000 employees. So about 25% smaller with these cuts, which are designed to save $1.8 billion per year. And as you said, consolidate 28 divisions into 15. So where are these cuts going to come from? Well, 3,500 workers at the Food and Drug Administration are going to be cut, 2,400 at CDC, 1,200 at NIH, 300 at CMS. They are saying that Medicare and Medicaid services won't be cut, or neither will reviewers of drugs, medical devices, and food at FDA or inspectors. But Manu, people in the public health world we're talking with say it's impossible to cut this deeply in the federal government and not affect services. So we're going to dig deeper to see where those are. But here's what RFK Jr. said about the reorganization and this new agency.
We're going to eliminate an entire alphabet soup of departments and agencies while preserving their core functions by merging them into a new organization called the Administration for a Healthy America, or AHA. We have two goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service.
Now, Manu, of course, AHA goes without saying, sounds a lot like MAHA.
So Meg, as you just said there, they're announcing this new agency called MAHA. So what exactly would that agency do?
So it consolidates 5 different agencies from around HHS under this one umbrella, including the Substance Abuse and Mental Health Services Administration and the Agency for Toxic Substances and Disease Registry. We don't know exactly what it's going to do, but you have to assume, Manu, what it's called, AHA, sounding just like MAHA, it was probably going to be one arm of how RFK Jr. tries to implement these priorities he's talked about around chronic diseases. But just a lot of skepticism and fear from the public health world, given his approach to vaccines and other scientific issues where they worry this may not be based on sound science.
All right, Meg Terrell on the latest on a very significant move out of RFK Jr.'s Department of Health and Human Services. Thank you for that report. And I'm joined now at the table with a terrific group of reporters. CNN's Priscilla Alvarez, Tyler Pager with the New York Times, and Abby Livingston with Puck. Good afternoon to you all. Nice to see you. RFK Jr. has sort of had his sights set on FDA for some time. Look at just what he said last October on this long post on X criticizing the FDA and also ultimately saying, if you work for the FDA and are part of this corrupt system, I have 2 messages for you. Preserve your records and pack your bags. And it seems like he's fulfilling that mission now.
Yeah, I listened to what he said, and that will certainly illustrate what's happening now. Look, this is something that they have previewed multiple times. They've been teasing it. He's acting on it. You were talking about, and Meg was talking about MAHA. Don't underestimate the power. That is what buoyed him to this. That is an incredibly important constituency for this president and this administration. And that is what they are acting on. Now, I think the other part of this, though, is he said, RFK Jr., preserving the core functions when he was describing all of these layoffs. That's going to take time to see whether that can actually be fulfilled when you are cutting that deeply.
What does that mean, core functions?
Exactly. And remember, this was something that came up during his confirmation hearings, is what accountability is he going to have? This came up, for example, with Senator Bill Cassidy on the floor. That is going to be the question that we just can't answer right now. Experts are obviously warning that if you cut this deep, there are going to be ramifications. But this is something that will be seen over time. And the question is, how is the department going to be held accountable as to whether or not they can actually preserve those core functions and not have some of these services completely fall through the cracks for Americans across the country?
Yeah, and look, these are the number of cuts, job cuts, as Meg reported, but just to remind viewers, 3,500 cuts to FDA, 2,400 cuts to CDC, 1,200 to NIH, and 300 for Centers for Medicare and Medicaid. How do you think Republicans are going to deal with this? A lot of them have expressed some concern about how quickly they have moved to purge employees, given that some of them are in their own districts.
Well, I mean, we see Republicans are very reluctant to criticize anything in this administration. What I'm watching for is, I spoke this morning with a source who works on healthcare policy. She said that these cuts are going to target hospitals, research and clinical trials. I think the political implications of this are going to come months down the road, and they are going to be severe. If you're in experimental cancer research, this could be a very big problem, and Republicans will then begin to feel the pressure.
What are you hearing from inside the administration on this?
Yeah, look, I think this is part of a broader strategy, not just to reduce the overall federal workforce, but to also take more control of what's going on within these agencies. One of the things that RFK Jr. said in that video was he was consolidating these departments that will then report more directly to him instead of some of these sub-agencies. And so it's not just about reducing the workforce to be able to tout, I've saved the government, the taxpayers this much money. It's also to have more influence and power over these individuals. And I think that's what's really important here, as you guys were talking about what the impacts are going to be for Americans. When you look down the road, there is going to be more influence of RFK's vision of what healthcare policy looks like. And there are some concerns, not just from Democrats, we should remember, but also from Republicans, specifically as it relates to his views on vaccines, vaccine safety, and vaccine trials. And so if he has more control over data and personnel overseeing those matters, that could portend trouble, not just for Democrats who are critical of his views on vaccines, but we can't forget the hearings in the Senate. That was a question he was repeatedly asked, and there were some real concerns from Republicans.
And Bill Cassidy, the chairman of the Senate Help Committee, ultimately voted for him because he got some reassurances on vaccines. But there have been some concerns that have been raised, as Tyler was mentioning, because of some of the actions that have been taken. Just a couple of the headlines here. Vaccine skeptic hired to head federal study of immunizations and autism. That's from a Washington Post story just a couple of days ago. And also just there have been FDA meetings, an FDA meeting to choose the flu vaccine that was canceled. They didn't really have any explanation to that. Another one, HHS said to have asked CDC to study vaccines and autism despite robust evidence showing no link. So perhaps his reassurances to Bill Cassidy that he wasn't going to try to push his own views and be more open to it, maybe he may be going back on it. At least that could be the concern.
Well, and internally, what all those headlines were sort of flicking at is that it is using or officials trying to shore up an argument or to find evidence to meet the point that the secretary is making or the administration is making. I have seen this with HHS on immigration. There was a time where the CDC was saying that there wasn't the threat of more COVID-19 with migrants, but they were put in a position where they had to get to yes for the administration, and so came the public health order that completely barred asylum on the U.S.-Mexico border. So all of this to say that they are, the effect of this is that some officials may be tasked with things that they know there isn't evidence, but they have to find it to make a point.
Yeah, we'll see how that ultimately plays out, or if they say, okay, there's no evidence, tell the public that there's no evidence linking the two, autism and vaccines. We'll see how they proceed.